Have you ever looked at your nails and wondered if they might be trying to tell you something? Most people see their nails as nothing more than a cosmetic feature. They trim them, paint them, and rarely give them a second thought. But what if I told you that your nails can sometimes reveal important clues about what's happening inside your body, sometimes even before obvious symptoms appear? Your nails are made of a protein called keratin and grow from living tissue supplied by your bloodstream. Because of this connection, certain health conditions can cause visible changes in the color, shape, or texture of your nails. Now, it's important to understand that nail changes alone do not diagnose any disease. However, they can sometimes serve as warning signs that deserve medical attention. Today, we're looking at 9 nail changes that doctors and dermatologists often pay attention to. Take another look at your nails. What we're about to cover next includes some of the most overlooked warning signs in medicine. These changes may seem minor, but in some cases, they can point to serious health conditions that deserve attention. Sign number 4. Terry's nails. Look at the color of your nails. Normally, the nail bed appears pink because of healthy blood flow underneath. But in some people, most of the nail turns pale or white, while a narrow, darker band remains near the tip. This appearance is known as Terry's nails. Doctors have associated Terry's nails with several underlying conditions, including liver disease, congestive heart failure, type 2 diabetes, chronic kidney disease. Researchers believe these changes occur because of alterations in blood flow and connective tissue beneath the nail. Now, having Terry's nails does not automatically mean you have one of these conditions. However, if you notice this pattern, and especially if you also experience symptoms such as fatigue, swelling, shortness of breath, or unexplained weight changes, it's worth discussing with your healthcare provider. Because sometimes the body sends subtle signals long before major symptoms appear. Sign number 5. Nail pitting. Run your finger across the surface of your nails. Do they feel smooth? Or do you notice tiny dents or pits scattered across the nail surface? These small depressions are called nail pits, and they are one of the most common nail findings in people with psoriasis. But here's what many people don't realize. Psoriasis is not just a skin condition. It is now recognized as a chronic inflammatory disease that can affect the entire body. People with psoriasis, particularly those with nail involvement, have a higher risk of developing psoriatic arthritis, a condition that can damage joints if left untreated. Some studies have also shown an increased risk of cardiovascular disease among individuals with severe psoriasis. If nail pitting appears together with joint pain, skin plaques, persistent fatigue, a family history of autoimmune disease, it may be worth seeking medical evaluation. Early diagnosis can help prevent long-term complications. Sign number 6. A dark line running through the nail. Now look carefully for a dark brown or black streak that runs vertically from the base of the nail to the tip. In many cases, especially among people with darker skin tones, these streaks are completely harmless and occur naturally. However, there are situations where a new or changing dark streak should never be ignored. Pay close attention if the streak appears suddenly, becomes wider over time, changes color, has irregular borders, extends onto the surrounding skin near the nail. Because in rare cases, these changes can be associated with subungual melanoma, a form of melanoma that develops beneath the nail. Subungual melanoma is uncommon, but it is often diagnosed late because many people mistake it for a bruise or a harmless pigment streak. And when it comes to melanoma, early detection can make an enormous difference. If you notice a new or changing dark band on a nail, especially if it affects only one nail, it's important to have it evaluated by a dermatologist. So far, we've covered 6 nail changes that can provide valuable clues about your health. But the final 3 signs may be even more surprising. One of them can reveal a major illness that happened months ago. Another may indicate severe anemia. And the last one is often dismissed as a cosmetic issue when it could actually point to thyroid disease or an autoimmune condition. Sign number 1. Clubbing. Take a look at your fingertips from the side. Normally, there is a slight angle between the nail and the skin beneath it, but in a condition called clubbing, that angle gradually disappears. The fingertips become rounder and larger, and the nails begin curving downward over the tips of the fingers. This change usually develops slowly over time and is often linked to long-term low oxygen levels in the blood. Doctors may investigate clubbing for possible underlying conditions, such as chronic lung disease, certain heart conditions, inflammatory bowel disease, or, in some cases, lung cancer. Because clubbing develops gradually, many people don't notice it happening until it becomes quite obvious. If your fingertips seem significantly rounder than before, it's worth mentioning it to a healthcare professional. Sign number 2, spoon nails. Now let's talk about something called spoon nails. Instead of having a normal curve, the nail becomes unusually flat or even dips inward, creating a spoon-like appearance. In medical terms, this condition is known as koilonychia. One of the most common causes is iron deficiency anemia. Iron plays an important role in maintaining healthy nail structure. When iron levels remain low for a long period, the nails may become thin, weak, and start changing shape. People with iron deficiency may also experience symptoms such as fatigue, weakness, dizziness, pale skin, or shortness of breath. While spoon nails don't automatically mean something serious is happening, they can be an important clue that your body may be lacking iron or that another medical issue needs investigation. Sign number 3, yellow nails. Have you ever noticed nails that appear unusually yellow? Sometimes the cause is simple. Nail polish staining and fungal infections are common reasons for yellow discoloration. However, persistent yellow nails can occasionally be associated with other health conditions. Doctors may consider possibilities such as diabetes, chronic respiratory problems, or a rare condition known as yellow nail syndrome. With yellow nail syndrome, nails may become thicker, grow more slowly, and lose the small white half-moon shape near the base. Again, yellow nails do not automatically mean you have a serious illness. But if the discoloration persists for weeks or months without an obvious explanation, it may be worth discussing with your doctor. The next nail sign has been linked to conditions involving the liver, heart, kidneys, and blood circulation. Most people have never heard of it, yet it's something you can check in just a few seconds. Sign number 7, pale nails, a possible warning of anemia. Now look closely at your nails again. Do they look unusually pale? Not white like we discussed earlier, but lacking their normal healthy pink color. Here's a simple test. Press gently on one of your nails for a second and then release it. The pink color should return almost immediately. If it takes longer than usual, or if your nails consistently appear pale, your body may be signaling a problem. One of the most common causes is anemia, a condition where your blood doesn't carry enough oxygen. Anemia can develop from iron deficiency, chronic kidney disease, bone marrow disorders, or other underlying medical conditions. When oxygen delivery drops, your nail beds often lose their healthy color. And because nails are easy to see, they can become one of the earliest visible clues. If pale nails are accompanied by fatigue, dizziness, weakness, shortness of breath, or feeling exhausted after minor activities, it's worth discussing with your doctor. Sometimes the cause is simple. Sometimes it isn't. But your nails may be telling you something important long before a serious condition is diagnosed. Sign number 8, horizontal grooves across the nail. Now look for horizontal lines running across your nails. Not scratches, not cracks, actual grooves that stretch from one side of the nail to the other. These are called Beau's lines. They form when nail growth temporarily stops or slows down because the body experiences significant stress. Think of them as a timestamp left behind by a difficult event your body had to endure. That event could be a serious infection, high fever, major surgery, severe emotional stress, poorly controlled diabetes, nutritional deficiencies, significant illness. Since fingernails grow at a relatively predictable rate, doctors can often estimate when the event occurred based on where the groove appears on the nail. A line near the center of the nail may indicate something happened several months ago. One groove on one nail may simply result from local injury, but when multiple nails develop the same groove at the same time, it often suggests a whole body event rather than a simple accident. Your nails can sometimes reveal a chapter of your medical history that you may have forgotten. Sign number 9. Brittle nails that break easily. The final sign is one of the most common: brittle nails. Nails that split, peel, crack, or break easily. Many people assume this is just a cosmetic issue, and sometimes it is. Frequent hand washing, exposure to chemicals, dry weather, and aging can all contribute. But persistent brittle nails can also point toward deeper health concerns. One of the most common medical causes is hypothyroidism, an underactive thyroid. The thyroid helps regulate many functions throughout the body, including nail growth. When thyroid hormone levels drop, nails often become dry, weak, and fragile. Brittle nails can also be linked to deficiencies in important nutrients such as iron, zinc, selenium. In some cases, they may even appear alongside autoimmune disorders that affect circulation and tissue health. If brittle nails occur together with symptoms like fatigue, weight gain, feeling cold frequently, brain fog, hair thinning, then your nails may be reflecting a problem that deserves medical attention. The good news? Many of these conditions can be identified through routine blood tests. Final thoughts. Here's the most important thing to remember. Your nails are not just decoration. They are living structures connected to your bloodstream and influenced by what is happening inside your body. Today, we covered 9 important nail changes: clubbing, spoon nails, yellow nails, Terry's nails, nail pitting, dark streaks, pale nails, Beau's lines, brittle nails. None of these signs automatically mean you have a serious disease, but they are signals, and signals exist for a reason. The people who benefit most from early detection are often the ones who simply noticed a change and acted on it before symptoms became severe. So after watching this video, take 1 minute. Look at your nails carefully. Pay attention to any changes. And if something doesn't seem right, don't ignore it. Talk to a healthcare professional and get it checked. Sometimes the smallest clues can reveal the biggest health problems. And sometimes those clues are right at your fingertips. If you found this video helpful, subscribe and turn on notifications for more health insights that could help you recognize important warning signs before it's too late.